Hip problems are extremely common in both the dog and the cat. Before we talk about the most common surgical procedure that we perform on the hip, let's first look at the anatomy of the hip joint. The hip joint in the dog and the cat is very similar to the hip joint in people. The hip is composed of a ball, what we call the femoral head, that inserts into a socket, what we call the acetabulum. The ball rotates inside this socket to provide rotational mobility and also flexion and extension of the hip joint. In dogs and in cats, flexion and extension is far more important than rotation. People require extreme amount of rotation of the hip. The problems that we tend to see in dogs and cats can be multiple. One of the more common issues that we see in the dog is severe arthritis of the hip. This is an example of a severely arthritic hip, and you can see there's misshapen, the head has become misshapen, there's severe arthritis on both sides of the joint. This can cause extreme pain, and in some cases, the hip can actually dislocate out of the joint. The most common procedure we perform in the hip of the dog or the cat for either severe arthritis or potentially a fracture or hip luxation is a technique called an FHO. This stands for femoral head osteotomy. With this technique, we surgically remove the ball and neck of the femur. We do this using a very fine oscillating saw, and this mark that we have on the femoral neck represents where we actually cut the femur. With this technique, we're removing the ball and the neck, so effectively we no longer have contact between the femur and the acetabulum.
These are post-operative x-rays for a dog that have femoral head and neck osteotomy, or FHO, performed. This dog was hit by a car and had a fracture of the femoral neck, and it was determined that the best course of action would be to remove the femoral head and neck. And what we do on these cases is essentially we make a cut. If I use the normal leg as a comparison, we make a cut with a bone saw along this axis, and you can see that the head and neck is missing on this side. This allows the joint to float freely. There's not truly a joint anymore because dogs are not walking upright. They can tolerate this very well, and this dog actually returned to excellent function post-operatively.
Movement of the leg is provided by the muscles that insert on the top of the femur. So flexion and extension will take place, but there will no longer be any rotation. This, however, works extremely well in the dog for a pain-free movable hip joint. Following this procedure, it's extremely important that you keep your dog or your cat confined. Cats should be kept indoors for the 12 weeks following surgery. Dogs, when outside, should be on leash at all times. And in the case of dogs in particular, it's important that active leash walking be performed during that 12-week period. This provides physiotherapy which will accelerate the recovery on the limb and regain muscle mass on the leg.